There is new research this week showing that heavy drinking can double your cancer risk. Let's bring in CTV News medical specialist, Dr. Marla Shapiro. Dr. Marla, thanks for being here. Tell us a little more about this study.
So this is an ongoing group of people that have been followed over a long period of time, more than 20 years, 88,000 people. And this is a subgroup analysis of people followed over the 20 years, looking at their risk specifically here with colorectal cancer. So in the group that was followed, there were a number who developed adenomas, which are precursor cancers. So those are not yet cancers, but we worry about them and take them out when we see them. And there were about 1,600 people who developed colorectal cancer. And what they were looking at specifically was the amount of alcohol that you drank as a risk factor for colorectal and whether or not there was a dose response. And in fact, when we look at alcohol, there is, in a sense, a dose response. And if you look at the study, the more that you drank, the more likely you were to have colorectal cancer. So remember, when we say colorectal cancer, we're talking about the right side of the colon, the transverse colon, and then the left side of the colon down to the rectum. So it's your large bowel is like an inverse C. So with heavy drinkers, we saw a 25% risk of colorectal cancer overall. But rectal cancer was particularly high in heavy drinkers. There was a extreme increased risk over those with moderate drinking. And moderate drinking, while not zero, had a much lower risk than heavy drinkers. And heavy drinkers here, we're talking about more than 14 drinks per week. We're looking at moderate drinking as 2 drinks per day, more or less. So not zero risk, but definitely there was a dose response if you take a look at it. And if we look at the magnitude of the drinks, and here you can see here, we're looking at that 2+ drinks per day raises the risk and about range of 21%. But once you're into the heavy drinking range, you're looking at more than a 52% risk of colorectal cancer.
Oh dear. What group of the population is at the highest risk?
So the highest risk would be those who are chronic drinkers on an ongoing basis, even more so than binge drinkers. We worry about, for example, youth with binge drinkers. But alcohol, people forget, is a group 1 carcinogen. We don't talk about what the lower limit of risk is. It's about 4% of American cancers. And if you look at the data from the United States, which is where this study is from, you've got almost 19,000 cases of colorectal cancer from alcohol exposure alone. So when we talk about modifiable risk, this is a significant modifiable risk that people can look at in terms of moderating how much alcohol that they have.
And if someone is a heavy drinker and they're looking for help, what do you recommend that they do?
Well, the first thing is recognizing that you've got an issue with help. There are medications that are available. People don't recognize that the acetaldehyde in the alcohol itself can cause disruption to DNA. We think that that's probably part of what happens in terms of the mechanism of risk for this exposure as a carcinogen. It causes oxidative risk, it causes inflammation, it causes folate disruption. There are a lot of support groups that are available in Canada, in the United States. You know, a good place to start is with your family doctor. For many alcohol groups, self-referral, even if you don't have a primary care physician, because we worry about that. There are self-referral groups where you yourself can send yourself, ask for help, go for help to look at moderating your drinking. Because truly, when you look at these numbers, this is one of the easiest modifiable risks that we have. We talk about, you know, barbecued food, we talk about deli foods as being risks as well. But alcohol itself, and particularly in this study followed over time, had a significant increased risk that was really quite worrisome when you look at the numbers.
All right. As CTV medical specialist, Dr. Marla Shapiro, nice chatting with you as always. Thanks for being here.
See you next time.